6 million children per year undergo anesthesia, but how many of these cases are out of the operating room? Because hospitalized children experience an increase in anxiety and a decrease in compliance, anesthesia is commonly used in procedures taking place out of the operating room. These procedures are typically not painful, though MRIs, CT scans, and other non-invasive tests are frequently performed with anesthesia. Out-of-surgery procedures are those that are non-invasive, can be completed under local anesthesia, and are considered physically painless. A few examples of non-invasive procedures are MRIs, CTs, PET scans, and dental procedures. While there are various non-invasive procedures, research commonly focuses on MRI scans because of the frequent use of anesthesia and the vast amount of alternatives for these medications. Anesthetics and sedatives can increase the risk of adverse reactions, such as complications with the heart and lungs. Furthermore, anesthesia has been shown to increase negative psychological behaviors. Fortunately, alternatives to sedation and anesthesia are accessible. Child life specialists create therapeutic play interventions that increase the understanding of the process and decrease the need for these harmful medications. MRI imaging has become a popular approach to aid in diagnosing and treating pediatric patients. While MRIs initially helped diagnose neurological and musculoskeletal ailments, the scans now help to diagnose thoracic and abdominal issues. Studies have shown that 2/3 of patients experience anxiety associated with MRIs. Therefore, children undergo anesthesia to complete a successful procedure. Young patients report being afraid of the loud magnetic noises, feeling trapped in a tight space, the uncertainty of a situation, and the IV that is often used for contrast, while in teenagers, the main concern is claustrophobia. When a person is anxious, there are feelings of apprehension, tension, and autonomic reactions, all of which can lead to undesirable behaviors. The issue of compliance comes along with anxiety. While anxiety is a predictive factor of compliance, adjustability, attention problems, and functional communication skills contribute to a child's ability to comply. Because changes in the environment are anxiety-provoking, it is critical to acknowledge a reason some children become extremely anxious. Children who have difficulties paying attention and communicating are less likely to comply without any preparation because of the challenges with following directions. MRIs require patients to lie still for up to 1 hour. 25% of children cannot stay still in an MRI for more than 5 minutes, which in turn often means an unsuccessful scan. Due to the inability to lie still, children younger than 8 commonly receive anesthesia. Age is frequently considered to be a factor in determining the need of anesthesia. However, research has shown that age is not a significant factor. Parents' opinions have been shown to be a predictor of compliance. Parents judged how their child handled past medical procedures and predicted how their child would cope with the stress. This suggests that a patient's past medical experiences are predictive of the child's ability to comply, which demonstrates the importance of psychological preparation and engaging with child life specialists for any procedure. Unfortunately, most healthcare professionals assume anesthesia is the only way to perform a successful out-of-surgery procedure, but that is simply not the case. Currently, healthcare workers rely on anesthesia to perform successful out-of-surgery procedures. However, there are risks associated with the use of anesthesia. Children who undergo anesthesia twice or more before the age of 4 have increased risk of cognitive impairments, including attention problems and learning disabilities. Additionally, Children who are medicated with anesthesia before the age of 2 are more likely to develop ADHD than their non-medicated counterparts. Furthermore, children who undergo anesthesia often are more likely to experience language and abstract reasoning deficits at the age of 10. Research has also concluded that children who have hernia repairs under anesthesia before the age of 3 are twice as likely to develop behavioral and cognitive deficits than their non-surgical counterparts. A study conducted over the course of 7 years found that 49% of children experienced cardiac complications to anesthetics due to the fact that these medications depress cardiac function. Even though anesthesia is assumed to be effective, there is a failure rate of 5 to 10% where the patient remains alert and awake. Because each patient differs, the amount of medication that will successfully immobilize the patient is inconsistent. Too much anesthesia can lead to dysfunction of the reflexes, which can cause airways to close. In addition, children with serious health conditions, such as sickle cell disease, are at a higher risk for experiencing physical complications, such as vasculo-occlusive issues, which can lead to necessary blood transfusions. Besides cardiac complications, anesthesia may cause gastrointestinal issues. 23% of children who underwent anesthesia experienced gastrointestinal effects, such as nausea and vomiting. Children who undergo anesthesia more than 2 times experience behavioral and emotional changes. Children who undergo anesthesia multiple times are at a higher risk of developing depression and anxiety, sleep problems, and attention issues. Sleep disturbances, crying, and temper tantrums have been found to occur in 50% of patients after waking up from anesthesia. One study concluded that 24% of children experienced negative behavioral changes after 3 days, while that number only decreased to 16% after 30 days. Children's hospitals have utilized tools to help decrease the use of anesthesia. Child life specialists study child development, coping mechanisms, and interventions to care to the psychosocial needs of hospitalized children. Using preparation, play, education, and therapeutic activities, child life specialists assist the needs of children undergoing various medical procedures. For example, a child life specialist will demonstrate an IV placement on a doll, educate the patient on each step of the process, and engage the child in medical play related to IVs. Child life specialists work at building rapport with patients, and they are the key component for reducing anxiety. Findings show that after radiation therapy patients interacted with the child life specialists, only 40.8% of children required anesthesia, compared to 57% previously. While tools and toys are helpful, child life specialists can complete their job without them due to the ability to build rapport and accurately and appropriately explain information. A child life specialist will first meet the patient and family to build a rapport through play and activities. The child life specialist will determine how much the patient understands about the procedure and if there are any misconceptions, as well as past medical history and experiences. By using iPads, medical dolls, and medical equipment, child life specialists expose patients to various aspects of hospitalization. Each step of the hospitalization or procedure is explained in order for the child to understand the sequence of events. With the help of a child life specialist, the patient will participate in medical play to familiarize him or herself with the tools that will be used during the procedure. Children are encouraged to rehearse the procedure from the position of both the doctor and patient. During the actual procedure, children are given either a movie, music, or an audiobook to distract them. Additionally, the child life specialist may assist in guided imagery to help relax the patient. Without child life specialists, hospitals would not be able to provide effective alternatives to anesthesia during non. By engaging in medical play, children gain an understanding of their situation. Preparation includes familiarizing the patient with medical equipment and processes, allows for questions to be answered, and introduces coping strategies to help relax and minimize anxiety. 169 children who were scheduled to have an MRI engaged in play therapy consisting of dolls and mini MRI machines before their procedures. Only one of those 169 children required general anesthesia for the MRI. Photo books are often used to prepare the patient by showing actual pictures of an MRI machine. The procedure is explained by using age-appropriate language. For example, explaining an MRI as a big camera that is taking pictures of your body can be helpful for a child to understand. Although hospitals generally sedate children younger than 8 for out-of-surgery procedures, research suggests that children as young as 3 and a half benefit from preparation and can complete a procedure without anesthesia. Kahn and colleagues reported a 44.9% reduction in children younger than 7 receiving a CT scan with the help of child life specialists. One tool that child life specialists use is a mock MRI scanner. The mock MRI is used to explain the procedure to the patient, gain mastery and control of the situation, and instruct the patient on what to do during the scan. Out of the children who successfully participated in preparation, i.e. a mock scanner, 92.3% of them completed the real scan successfully without anesthesia, and the 1.8% of children who could not lie in the practiced MRI were eliminated from the study. Simulated experiences are common when preparing for MRI scans. In order to instill a sense of control and mastery, children are given choices when appropriate, such as which video to watch. The child will then lie in the mock MRI, and recorded noises of the machine are played through headphones. While the child practices lying still, a parent or caregiver should stay next to the child and is encouraged to stay in physical contact. During this practice session, the child life specialist will practice guided imagery. Preparation methods contribute to the sense of mastery of a child can develop during a hospital experience. An inexpensive mock MRI scanner costs approximately $80, and while commercial mock MRIs are more costly, there have not been any studies that demonstrated differences between the two. The most important feature in a mock MRI is the tightly enclosed space. When children are taught about the MRI and encouraged to stay still in a tight space, the likelihood of a successful MRI without sedation or anesthesia increases, suggesting that practicing compliance is helpful. By practicing procedures and introducing information, a child life specialist is desensitizing patients. Completing MRIs or other non-invasive procedures without anesthesia is helpful because exposure allows for other procedures to be done that cannot be performed under anesthesia, such as a functional MRI. While psychological preparation and medical play are invaluable for children 3 years of age and older, infants are not capable of understanding. Sedation in infants can be dangerous, as these medications often cause desaturation. Fortunately, there are alternatives to sedation for young infants and toddlers. A pacifier can be effective in calming the baby into a state of relaxation. An oral sucralose solution is often used in conjunction with a pacifier and successfully eliminates the use of sedation, as it has calming and pain-relieving effects. Additionally, swaddling has been found to reduce distress, eliminate movement, and decrease crying and encourage sleeping. Another way to reduce the need for anesthesia in infants is the feed and wrap technique, which consists of feeding the child 30 minutes before the procedure. This mimics the baby's sleep routine. Sleep deprivation is another method for avoiding anesthesia. Restricting naps or keeping the infant awake at night can cause exhaustion in the infant, which leads the baby to fall asleep easily. As a child life practicum student, I witnessed the efficacy of preparation and medical play to avoid anesthesia. Because this patient had never had an MRI before, the scan was initially scheduled with anesthesia. When meeting with the patient, the child life specialist provided pictures of the exact machine the child would be using, images of the MRI scan, and a doll and mock MRI machine. The child life specialist explained what the child would experience for all 5 senses, which gave the child appropriate expectations of the procedure. The child life specialist and the patient practiced the MRI with the doll as the patient described how the doll was feeling. While the child sat in the waiting room, he was provided with a list of movies he could choose from. The movie was set up on a portable DVD player that distracted him for the hour-long procedure. I was fortunate to see firsthand the effectiveness of preparation and medical play, which led to a successful MRI performed without anesthesia. Furthermore, modern technology has helped decrease anxiety and distract the patient during procedures. By providing video goggles, mobile DVD players, and color light shows, patients can be distracted from the loud noises and remain still. While the addition of modern technology may sound expensive, it will actually save hospitals money. Not only have video goggles and DVD players reduced the need for anesthesia, but it has also increased patient and family satisfaction. Patients and families view the inclusion of this technology as a dedication to the hospital's patients. Children undergoing radiation therapy are often administered anesthesia to reduce anxiety and increase compliance. Researchers consider current healthcare costs and predict that with the use of child life specialists for 100 radiation patients ages 3 to 12, hospitals will save $775,000 annually. A 6-week radiation treatment, including anesthesia, can cost approximately $50,000. $30,000 of that is for anesthesia medications. That being said, child life specialists have an average salary of $50,000, suggesting a large amount of savings hospitals can have. With the employment of a child life specialist, radiation therapy centers that treat over 200 pediatric patients can save over $1 million with the elimination of anesthesia. Using anesthesia requires more medical care than performing a procedure without sedation. Anesthesiologists, nurse anesthetists, and recovery nurses are all required when using anesthesia. Most out-of-operating room procedures performed with anesthesia are done in the outpatient surgery center. Therefore, there are added costs and requirements, such as recovery beds, additional staff, and more time needed for preparation and the procedure. Overall, minimizing the use of anesthesia in out-of-operating room procedures is healthier for pediatric patients, both in physical and socio-emotional aspects, as well as more cost-efficient for hospitals. Because hospitals are not the only medical facility that uses anesthesia during non-invasive procedures, it is imperative to spread this information across the entire medical field. Children, such as Daisy Lynn Torres, who is pictured here, experienced a fatal reaction to anesthesia during a dental procedure. The 14-month-old had 2 cavities to fill, but she never woke up from sedation after her heart stopped beating. Unfortunately, Daisy's experience was not the only incident. Over the course of 30 years, 44 dental patients died from anesthesia, and most of the patients were 2 to 5 years old. Doctors say it is normal to put a child under anesthesia for these procedures, which is evidence of the need for cultural change surrounding anesthesia. No matter what medical setting a child is in, there is almost always an alternative to sedation for non-invasive procedures. In conclusion, child life specialists are the key component in using these alternatives for non-invasive procedures. While some hospitals or other medical facilities do not have child life specialists, they're still capable of taking advantage of some of the alternatives, such as including modern technology in their office. Although doctors and child life specialists focus on different entities of the healthcare process, they are extremely intertwined and can make great progress in minimizing the use of anesthesia